Welcome back. I'm Dr. Cheek and I'm a licensed clinical psychologist. And today I'm going to be talking about something that comes up sometimes as a statement from clients when I first meet them. And that statement typically sounds a little like, I was hesitant to come in for therapy because I feel like therapy is for crazy people. And what I assume that to mean is that therapy is for people who have some type of major mental health concern. So today I'm going to talk about who needs therapy, or better yet, who could benefit from meeting with a psychologist or a therapist. First, I want to start by saying, what is therapy? Therapy is meant to provide guidance. It's meant to provide skills. It's meant to provide psychoeducation to help you understand what you're going through mentally and emotionally. It's meant to provide some level of insight. It's meant to give you space to process or deal with some things that feel a little bit more overwhelming or unbearable for you in those moments, or unmanageable for you in those moments. So that's the purpose of therapy. So who could benefit? Basically, anyone who feels like they are struggling with mental stability. Also, anyone who has never learned how to identify, acknowledge, feel, or express and manage their emotions. Or someone who's learned inappropriate ways of expressing or feeling their emotions. It's also for anyone who's dealing with life transitions, such as graduating or getting married or having a child or starting a new career or ending a career or changing careers. It could be losing a relationship. It could be losing loved ones or dealing with any type of transition in that way. It could be anyone who's dealing with a major medical condition, whether that's a medical condition such as like chronic pain or a terminal illness or having to deal with a complex medical procedure, or any medical or physical situation that can affect their quality of life could benefit from therapy services. Also, it could be beneficial to anyone who's had adverse life experiences. So it could be someone who's had negative childhood experiences or have dealt with assault or abuse as an adult and is having a hard time processing and dealing with those emotions. It can be for anyone who's maybe dealing with a serious mental illness. And when I'm talking about serious mental illness, what I mean by that is someone who may have schizophrenia or having some type of psychosis. But also along those same lines of schizophrenia, other serious mental illnesses are things such as bipolar disorder and major depressive disorder. But these are serious mental illnesses, and I think this is what people seem to assume are the only individuals that come in for mental health services. And even if you have one of those diagnoses, you still may be able to manage some of your symptoms without having to continuously meet with a mental health provider. Now, also, someone that can benefit from meeting with a mental health provider is anyone who's trying to maintain their progress and their growth. Sometimes we do refresher sessions where we talk about skills we've already learned or things we're already doing, just to make sure we are handling situations in the best possible way. And sometimes we need someone who has that level of understanding of human behavior to help us navigate that. And also, anyone who's wanting to maintain positive, healthy relationships with individuals in the world or individuals around them. And lastly, sometimes no therapy is therapy. I tell people this all the time. Simply because you are dealing with a life stressor, simply because things feel overwhelming, simply because you are feeling like you have some level of emotional instability, does not necessarily mean you need therapy. If you're experiencing these things and you feel like you are managing them adequately enough that you don't need to speak with anyone, that's okay. Not everyone needs therapy. If you feel like you are managing them, if you are continuing to move forward in life and be productive and live an adequate life for yourself, then you don't need therapy. Therapy may not be for you, and sometimes no therapy is therapy. Having the ability or the confidence in yourself to understand that you can handle even difficult situations is healthy. Even if you don't come to therapy when you're struggling and you're able to manage it on your own, gives you a level of self-confidence in your ability to navigate life. Because at this point, we understand that life is never going to be without its stressors. There is always going to be something. And it's beneficial for us to understand that we can navigate that with or without therapeutic services. So, what I hope you take from today's conversation is this. Anyone can benefit from seeing a psychologist or a therapist. And there are many reasons that we go to seek therapy. And it's not just because we have a serious mental illness, and we may not even have a diagnosable mental health concern. We may not have a true mental health concern. We may just be dealing with life stressors, and we need that support. We need that guidance. We need those skills. We need that understanding. And we need that ability to openly share without feeling judged, and to be able to navigate life stressors in a healthy way. And that's when you seek therapy. And if you're dealing with a serious mental illness, I encourage you to always seek guidance, to seek therapy, not only to understand, but to make sure you have the skills to navigate the things that are happening around you. So there are many people who can benefit from therapy. And it doesn't mean that you are crazy. It doesn't mean you have like a mental health disorder. And sometimes, again, no therapy is therapy, but you get to decide that for yourself. So I hope you've learned something from today's video. As always, I encourage you to write down any questions or concerns you have below. I thank you for taking the time to listen, and I'll be seeing you again very soon. Thank you.